Thank you so much, Anna, and thank you so much, Celine and Monika. That was such a fascinating talk and such a beautiful introduction to what I'm going to be talking about, actually. And on that note, before I share my slides, I want to say that my title has changed a bit. When I first applied to the conference back in the fall, I had an idea that I was working with, and I don't think, I can honestly say I have never spent so long trying to work on an idea for a conference presentation and still come to a point where I feel like it is a bit unfinished. So I would really welcome, of course, your questions, but also candid feedback about the idea that I'm working on here. So my title is now Touching at Depth During the COVID-19 Pandemic. I will just actually, let me just share my screen. Here we go. Everyone can see this?
Yes.
Okay. So my title is now Touching at Depth During the COVID-19 Pandemic, What Not Touching Babies Can Teach Us About How to Improve Healthcare. So earlier this spring, Extra Gum launched a video advertisement that quickly went viral. I don't know how popular this was in Europe, but for those of you who haven't seen it, to the soundtrack of Celine Dion's It's All Coming Back to Me Now, the commercial presents a fictitious depiction of the end of the COVID-19 pandemic, one in which everything suddenly and unexpectedly goes back to normal on a glorious summer's day. So in under 3 minutes, the clip captures much of what many of us have looked forward to, having a reason to get dressed up in the morning, the end of homeschooling for people who have had small children at home. But the overarching theme of the video, the key to the joy that it evokes, is the euphoric promise of being able to touch again. Neighbors pour into the streets, hugging each other in pajamas and bathrobes. Office workers throw their arms around their coworkers. And most of all, people express a lot of pent-up passion. The climax of the clip features a beautifully diverse crowd of couples kissing each other with wild abandon in a public park. I know quite a few people who admit to rewatching this gum advertisement over and over again. And some even openly admit that it brought tears to their eyes. People experience a lot of feelings while watching this video, obviously not because of the product that it is designed to sell, but because it effectively channels something meaningful about Western notions of closeness and intimacy, and the ways in which policies and norms aimed at limiting social contact to prevent viral spread have drastically reduced opportunities for this. And we've really seen that beautifully in the previous talk. So the message here, one which clearly resonates with many people, is not only that we haven't been able to touch and therefore give and receive affection, but that we haven't been able to express and experience closeness, care, or the intimacy that we need and that we all feel inside. So this idea that without physical touch, we're alone and can't be close. So this speaks to a theme that has come up often in interview-based qualitative research that I've been carrying out for the past year into the impacts of pandemic policies on experiences of pregnancy, birth, and early parenthood in Canada during the COVID-19 pandemic. And specifically, I'm referring to repeated expressions of grief and concern expressed by new mothers over the fact that friends and family members have not been able to hold their babies. So most of these mothers introduced their newborns to close friends and family from a safe distance quite soon after giving birth, but their narrative suggests that seeing the baby but not touching it was an inadequate experience. For many of them, something really vital is missing in meeting a newborn through sight alone. So I'm just going to show you a couple examples of quotes. This mother said, "I drove to see my parents and let them see the baby through the car, which is not the same. It's really sad, actually. My parents couldn't even hold her or touch her. They just had to look at her through a car window." And similarly, after maybe 3 days, my husband's parents came over from Salt Spring Island. We made a mug of coffee, we got muffins, they brought their own lawn chairs. They sat out on the lawn below our apartment balcony and looked up at our grandson, our baby, and I just bawled the whole time. I just cried and cried because it just seemed impossibly sad that they couldn't properly hold or smell or touch their grandson, their first grandchild. Eventually, after about 4 weeks, we decided that they could hold the baby. There were a lot of tears on all sides after that. So these kinds of statements kept on coming up over and over in the interviews that I did. And at first it didn't make much of it, especially because the interviews contained a lot of much more concerning examples of what I would call obstetric violence. But as I conducted more and more interviews, I began to wonder why this particular issue came up so often in response to very general questions about what it's been like having a newborn during the pandemic. So I've read, thought, and ruminated long and hard about what to make of this, especially in relation to other data from the study, which shows that many women who gave birth in hospital during the pandemic felt neglected and abandoned by the healthcare system. So in making sense of this, I'm going to take you on an admittedly meandering path through my study data, social theories of touch, my reading of pandemic popular culture, like the gum ad, and my own autoethnographic experience of early parenthood during the pandemic to respond to two related questions. Firstly, what can reactions to social distancing practices and related policies teach us about the relationship between touch, affect, and intimacy in Canada, and I would argue in other societies as well that share some similarities in terms of social norms around touch and intimacy? And secondly, how can this knowledge help us improve healthcare? And that's the piece that I really see as an ongoing kind of open-ended question. And I found it really interesting to see in the previous talk some of the ways that people have tried to get around that or to act on that. And my thoughts on this are preliminary and exploratory. So as I said, I would welcome feedback. Social norms of interpersonal touch are cultural, as are the affective experiences that touch evokes and entails. In Western society, physical or haptic touch is closely aligned with emotional intimacy, as evident, for instance, in English expressions like being touched by a kind gesture. So touch here has an affective correlate, of course. Philosophers who've addressed physical touch and affect, such as Maurice Merleau-Ponty and Luce Irigaray, root this connection in the simultaneous reciprocity of touch. So, you know, these hands are both touching and being touched at the same time. I'm touching you at the same time as you touch me. I learned that I'm a subject through the intimacy of being touched, and in this subjectivity is necessarily intersubjectivity vis-a-vis the world. Now, bringing this closer to my research project, as Merleau-Ponty suggests, the mother-infant relationship is the touchstone example of inter-embodiment and intersubjectivity that is illustrated by this hand-touching hand. Ample research suggests that mothers of newborns experience their bodies as phenomenologically entwined with that of their babies, a sense that is enhanced by acts of physical intimacy, affection, and care. And although a baby is not likely to have the same affective experience that, for instance, a grandparent does when the grandparent holds the baby for the first time, being securely held is arguably the first affective experience of human life. So given all this, having loved ones hold your newborn may be an effective touch experience that exceeds most other forms of indirect touch. And the pandemic has obviously placed a barrier between opportunities for this kind of intersubjective intimacy. Additionally, social researchers interested in touch, affect, and intersubjectivity in Western societies, and again, I say in Western societies because I'm leading up to a discussion of contexts where touch and intimacy are not necessarily so closely entwined or so necessarily so closely entwined in this way. And again, I thought it was interesting that the art and images and even hospital interventions that we saw in the previous touch were all either from Western Europe, North America, or Latin America, which is famously a very high touch societies, I guess, where physical intimacy is a deeply held social norm. So social researchers interested in touch, affect, and intersubjectivity in Western societies have noted that the degree of intimacy in a relationship is held to be measurable and perceivable to self and others in spatial and temporal terms. So in close relationships and weighty interpersonal encounters like goodbyes or a long-awaited meeting between a grandparent and a newborn, or in situations where emotional support is called for, intimacy and care are built, sustained, and reproduced through the phenomenon of there being little space between individuals, like a tight hug, and a longer time investment in physical touch. So the hug is long. And so emphasis here is placed on showing care and emotion through action, that is strongly haptic. And of course, the pandemic has disrupted this as well. So in my current research study, the inability to touch in this way, it wasn't just sad, it actually harmed relationships between new mothers and people who are emotionally close to her. For instance, Audrey, these are all pseudonyms. Audrey's second child was born in Toronto at the beginning of the first wave in Canada. So in April 2020, when there was a lot of fear and unknown about the virus's transmissibility and virulence. I'm sure you all remember that stage of the pandemic. Audrey had a difficult birth followed by serious medical complications for both herself and her newborn son, which required days of hospitalization for both. Once she returned home with her baby, she didn't receive the attention and support from friends and family that she had expected. She recognized that the pandemic was a factor in keeping people away. Public health guidelines strongly discouraged contact outside your immediate household, and those kinds of policies were applied universally across the population. There wasn't really a discussion at that time of making exceptions for people like Audrey who had particular needs for care and support. And people were also likely reluctant to come in contact with individuals who'd recently been in hospital, again, because of this heightened environment of fear. But Audrey viewed their physical distance, particularly refusals to visit or touch her son, as sad and unnecessary. So she said to me, I just feel like nobody was acknowledging that he was born, and then nobody came, or they'd just be like, I wish I could hold him. And my husband and I would be like, oh, you're totally welcome to. And they wouldn't, they just wouldn't. And it would just be so sad that nobody would hold him, even with a blanket, with gloves, with masks, outside, 2 meters away from me. And as this interview progressed, it became clear that she perceived this as a kind of conscious act of effective distancing from her. So she said, one could say that no one was able to help us because of the quarantine, but I perceived it as no one wanting to help us. I'm really angry because no one even really did the 2 meters apart outside visits with the kid. So no one had even laid eyes on him for months. My parents also, for example, they were at my house looking after my toddler while we were at the hospital, but they left 2 days before we brought the baby home. They could have obviously just maybe stayed 2 more days and met the baby, but they didn't. They went home 2 days early, and then they didn't meet him for months. His brother didn't hold him until the last day of June, and he was born March 15th. The brother is her husband's brother. That was really upsetting for me. So not all mothers in my study were angry in this way. Some experienced and expressed sadness, confusion, or just a kind of dejected feeling of neglect. But these damaged relationships are clearly an outcome of the pandemic that might take some time to mend. But beyond the ramifications of this for the relationships between these study participants and their loved ones, with time, I've begun to see a parallel and a connection between these experiences and emotions and those expressed by mothers in my study. And some of these are the same mothers who had difficult experiences in hospital. These women were left in hospital to recover from medically complicated deliveries because pandemic policies required their partners to leave shortly after they gave birth. And they also had much scaled back contact with healthcare providers, partly because the system was quite stretched, but also I'm told from talking to healthcare providers about this, the time it took to take on and off protective equipment to go into a room and check on a new mom was a deterrent or prohibitive. So these people had even less contact. They were without a support person, and they also had less contact with healthcare providers. So they expressed very similar emotions that ranged from anger to sort of sadness and a feeling of neglect. As this woman said, it was terrifying. I'd never had a baby before, and I had the whole night and then the whole next day to take care of a newborn by myself after having a hard labor and delivery. I was there alone. I was on pain medication, but I was still in pain. I was not set up to help women at all. It was more helpful for the staff than it was for the parent. I felt not by my partner, but by our healthcare system during this time, abandoned and forgotten about. And similarly, this is again, Audrey. I was using a wheelchair to move around because the neonatal intensive care unit is several floors up. We would try to sneak my husband in just to wheel me to the place, but then a nurse recognized us and we got yelled at and he had to leave. So I had to start walking up to the NICU myself. Again, this is days after the surgery, to go on these huge walks up to the 4th floor. I was just breaking. Then I had to go sit in this crazy uncomfortable chair with the baby, and it was just really hard physically by myself to do all this stuff. The nurses weren't allowed to come near me. I'm like, I need help. I need help with all these wires. My baby is attached to 7,000 wires. I can barely move. The baby is nursing. My water is over there, and no one could help me. Instead of just being understanding, I was yelled at. I was like, don't you understand? I just had a surgery and my baby is sick. I was pretty depressed. I would cry every day. I was so upset. So many women spoke of being left alone with their babies for hours and hours in pain, in sterile hospital rooms with no one checking on them, leading to feelings of despair and abandonment. Some stated that they have lost trust and confidence in the healthcare system as a result of their experience, and that they would not choose to have a baby in Canada again. This is obviously concerning, and for several months now, I've been ruminating on the appropriate response to this, and I've written elsewhere in a more kind of pragmatic, applied, talking to the healthcare system and policymakers forum about some pragmatic responses to this. But I think there's an opportunity here as well to think about this on a more effective relational level. So I want to move now to situations where people have felt not alone during the pandemic despite physical distance. So I'd like you to consider the following image, which is part of a story that also went viral on the internet and received a lot of press coverage during the pandemic. For those of you who are not familiar with this, according to the well-documented story, the young man here, Jeremy Cohen, apparently spotted the woman, Tony Signorella, dancing on the rooftop of an adjacent building in Brooklyn, New York during the height of the COVID-19 outbreak in that city. He was really captivated by her energy, although she was far away. You can actually see her here and get a sense of how far away she is. So he attached his phone number to a drone and flew it over to her. Captivated by her, yes, right. So she messaged him back and they had dinner together on their separate roofs, communicating via video chat. And that's what you can see here. And they continued dating remotely for months. When he was asked about this experience by Global News, Cohen is quoted as saying, "If this doesn't work out, which is a possibility, I'm sure we'll still be close. We've had this crazy experience together." And as of the end of last year, these lovebirds were apparently still going strong, although I haven't seen any recent media coverage of their relationship. So this story and the gum ad both went viral because they poignantly capture both the pain of interpersonal distance during the pandemic, both physical, emotional, and the beauty of overcoming this. And they're also both hopeful, but in very different ways. The second story here, and its popularity with the online public, suggests that the pandemic is providing new opportunities to overcome the physical boundaries that separate us, and that we may be becoming more attuned to fostering closeness and intimacy without haptic contact, even though we don't see this in the narratives of most mothers in my study. So in theorizing this form of closeness at distance, I found it helpful to look at the work of anthropologist Diana Adis-Tahan, specifically her concept of touching at depth, which she describes as, quote, "a thick inhabited space between people, which enables feelings of intimacy and closeness," quote, end of quote, without the need for physical touch. She developed this concept from the work of Merleau-Ponty, specifically his concept of flesh. So that is the body in its wholeness that is meaningful in its participation from the world. Again, this intersubjectivity with the world that I was talking about before. And also from Japanese philosopher Hiroshi Ichikawa's concept of me. Me is a concept of the body as a kind of all-encompassing whole that includes physical body, mind, heart, self, and relationality with all its interconnection to the environment. Both philosophers offer a theory of embodiment and affect that breaks down the binary opposition of the subject-object and reveals a different ontology of personhood that is both subject and object at once. So for Tahan, touching at depth is an analytic tool that first helped her understand a phenomenon that she witnessed and experienced during long-term ethnographic fieldwork in Japan, where as she states that physical touch is uncommon and relationships usually rely on more indirect and subtle forms of communication. She describes touching at depth as a relational quality that is not locatable in a particular body or a particular sense, but rather, quote, finds meaning through an embodied felt relation and a deep sense of connection. So I want to turn your attention to her description of touching at depth as depicted in her memories of watching TV sitcoms with her family in childhood. Tahan is explicit that she developed this concept to try and understand and explain intimacy and affect in Japan, but that it is much more widely applicable as well. So she's describing when she was like 12, 13 years old, watching TV sitcoms with her family in Australia. She says that there's a sensuous quality to this experience that connects the family at the deeper level, one where sight and sound connect them via the depths of touch. Touch simply happens through this connection via the TV and the laughter, but this is not comprised of separate subjects or bodies, mother, father, and children. Instead, there's a new mixed inclusive body that emerges through relation. There's an everywhereness to this experience where everyone is in relation, implicated, touching, and laughing. The relaxed tone of this experience emerges between the family. So I want to invite you all to think about experiences that you have had during the pandemic that have allowed you to feel close without touch. I think we all, or hopefully all of us, have been fortunate enough to have an experience like that. In my case, what immediately comes to mind is the friendship that I've developed with my 2-year-old son's best friend's parents. We met them during the pandemic because our sons go to the same preschool together. And I actually consider these people some of my closest friends in Montreal. I certainly see them much more often than anyone else, but I have never touched them. I have never been in their home. I have never met any of their other friends or family. But we feel close and supported by one another through a friendship built around watching our sons play together at the park, waiting at a distance from one another, masked outdoors in the Canadian winter for our turn to go into the preschool one at a time because of COVID regulations to fetch our children, and through sending each other pictures of our kids playing, and through frequent messages that we get from the preschool about our son's friendship via an app. So because parents are not allowed into the preschool anymore, except into the entryway to collect their children one at a time, they started using this app that sends us updates, and they send us pictures of our children playing with friends that we cannot have in our homes, and the friends that our sons have, but we don't in the same way. So sharing enjoyment of our sons' joy in each other's company has been the foundation of a friendship cultivated largely at distance. So to bring all these disparate threads together, what I want to ask is, how can we foster this sense of community in healthcare settings, places that are not known for warmth and where distance has been most stringently enforced? As we saw in the previous talk, there's a long history to this, but it's been particularly intense during the COVID-19 pandemic, I would say. And in my study of birthing women in Canada, we can really see the harms that has caused. So to answer this question, I've read Tahan's work closely to enumerate the mechanisms that she identifies for how touching at depth is cultivated in Japanese society. And there isn't time today to really go into this in depth, although I hope to do so in the future. I summarize this as follows. And you might think it's a stretch to suggest that this could extend into hospital settings, but I actually think it could. Tahan describes the warm feeling of an inhabited space, and surely a hospital room with a new baby could feel warm and inhabited if it was approached the right way. She describes touching at depth as grounded in greetings or daily rituals that highlight care. And the narratives of the mothers in my study really suggest that what greetings and daily rituals of care existed in the hospital have been removed, at least when it comes to obstetric care in Canada during the pandemic. There's been a focus on what is deemed essential by healthcare providers and policymakers, and that has been birth interventions, pain relief, with everything else taken away. Even, opportunity to advance labor and manage pain through movement by walking up and down the hallway or having a shower or something like that. Also, this is also achievable and markedly absent in hospitals during the pandemic. Tahan also states that touching at depth entails actively cultivating interpersonal empathy. And this is something that has long been widely acknowledged as hugely important for good medical care, especially during the pandemic, but has also really been identified as declining with medical training and practice. Some of you may be familiar with a huge body of research that suggests that medical trainees become less empathetic the more experienced they become. Finally, touching at depth is most easily cultivated in spaces that are comfortable, particularly spaces that are physically comfortable for a body to be in. And this is something that alternative spaces for birth, such as birth centers, promise to offer. And a lot of this was scaled back in Canada during the pandemic as well. Most birth centers were closed for reasons that were not entirely clearly conveyed to the public. And it's also something that was diminished during the pandemic in Canada in hospitals, given many people were not even permitted to bring in necessary items like extra underwear or pillows when they were going in to give birth. So this feeling of security also is diminished. So to conclude, in many wealthy countries, we're now seeing some light at the end of the tunnel, and many questions are being raised about the longer-term impacts of COVID-19 on societies, economically, politically, and socially. And while we'd all like to return to normal, I think there's an opportunity here to actually improve on the old normal, because what I've seen in my research study is some limitations to the way that healthcare is organized and practiced that have been long-standing, have really been laid bare during the pandemic. And I think fostering healthcare settings that are conducive to touching at depth would align with what is already known to be important for good care, while also setting the stage for a better response to future emergencies. And I would say that we are in a better position to think about what those kinds of changes might look like, given we're all more experienced than we were a year and a half ago at trying to foster intimacy in creative ways. Thank you very much.